Prior to implantation, all HeartMate system components must be inspected and prepared according to Thoratec's printed instructions for use, found in the implant suitcase. This section provides a visual overview of these procedures. A team consisting of a non-sterile circulating nurse and at least one sterile scrubbed-in device technician will set up and assemble the HeartMate components for surgical use. When directed by the surgeon to begin device preparation, the sterile device prep team member or members should scrub in, then prepare for device assembly by setting up 3 basins of sterile normal saline solution on a sterile table. The non-sterile team member should plug the power base unit or PBU into a 3-prong grounded electrical outlet within the OR environment, then turn its power switch on. Next, plug the large barrel connector on the PBU cable into the back of the PBU. Then connect the system monitor's beige control cable to the display connector located on the back panel of the PBU. The system monitor may then be turned on as well. Note, when initialization is complete, a not receiving data message should appear on the monitor screen, indicating that the system monitor is not yet linked to the system controller. Check that a minimum of 4 HeartMate rechargeable batteries are inserted into the charging slots of the PBU, and that at least 2 of these batteries are fully charged, indicated by green lights on the PBU. Once the system monitor and PBU are operating properly, open the implant device suitcase, remove the instructions for use manual and the device tracking record, and carefully examine the enclosed temperature sensors for color changes or bursting. If the temperature sensors are intact, this indicates that the valves have not been damaged by exposure to extreme temperatures and the suitcase contents may be used. Warning: if one or more of the sensors indicates that the suitcase contents have been exposed to extreme temperatures, then the valve conduits in the jars must not be used. Instead, new valve conduits must be obtained from the backup implant suitcase. Note: the serial numbers of all implanted components should be recorded on the device tracking registry form, using the stickers included in the envelope. The top white copy of the device tracking registry form should be mailed to Thoratec Corporation in the enclosed self-addressed envelope on the day of the implant. The remaining copies should be retained in the patient's chart. A non-sterile team member should now identify and open the glass jar containing the inflow valve conduit and allow a sterile team member to carefully remove it. Confirm that the serial number on this jar matches both the number on the tag attached to the valve and the stickers inside the device tracking registry envelope. Repeat the same procedure for the jar containing the outflow valve conduit, remembering to check its serial numbers as well. Caution: if either of the valve's serial numbers do not match the numbers on their containers, record the valve's tag number on the device tracking registry form and notify Thoratec Corporation. Remove and discard the white serial number tags on both valve conduits. Next, assess the integrity of the tissue valves by examining them closely. Both valve conduits should then be placed into the first basin of sterile normal saline solution, rinsed and gently agitated for 10 minutes. Next, the sterile blister pouch that contains both the LVAD blood pump and several implant components should be opened by a sterile team member. Place the small implant components in a secure location on the sterile field. Now, remove the outflow graft bend relief from the outflow graft and inspect the screw ring of the bend relief. Verify the presence of its white PTFE washer. If it's missing, a backup bend relief should be obtained and used. In a sterile basin, coat the external surface of the outflow graft evenly with autologous serum or another approved pre-clotting agent. After the valve conduits have rinsed for 10 minutes in the first basin, place them into the second basin of saline for 3 minutes, and finally into the third basin of saline for 3 minutes, or until they are ready for pre-clotting. It's important to complete this 10-3-3 rinse cycle. If required, heat the outflow graft in a pre-sterilized pan using an autoclave set at approximately 250 degrees for 3 to 4 minutes. Caution: not all pre-clotting agents require heat to congeal. Refer to the specific instructions for the pre-clotting agent you are using before proceeding. Now, place the tunneling shroud over the vent holes of the LVAD percutaneous tube to ensure a snug connection over both blue O-rings. Then, screw the protective tunneling bullet firmly onto the end of the percutaneous tube to protect it from fluids. After rinsing, pre-clot the external surfaces of the valve conduits with non-heparinized blood from the patient or another approved pre-clotting material. Note, if using whole blood as a pre-clotting agent, it may take as long as 30 to 40 minutes for an acceptable clot to form in cases of coagulopathy. Caution: during the valve conduit pre-clotting process, moisten the porcine valves with saline every 3 to 5 minutes to prevent them from drying out. To prevent the pre-clotting agent from contacting the tissue valves inside the valve conduits and to protect the valve threads, place finger cots cut from sterile, non-powdered glove tips onto the ends of the valve conduits. After the outflow graft has been heated and cooled, reapply the bend relief to it. Then attach the white thread protector to the metal screw ring on the bend relief. The LVAD is now ready for assembly. Note, the anterior or blood side of the LVAD has a dull crystal pattern design. The posterior or motor side of the LVAD is flat and shiny. Directional arrows on the anterior side indicate the path of blood flow through the pump. When assembling the pump, always orient it so that the anterior side, with its crystal pattern, is facing up towards you. To begin pump assembly, first mate the inflow valve conduit to the inflow elbow, on the right side when the anterior side is facing you. Then thread it onto the elbow by holding and turning just the base of the valve conduit in a clockwise direction until it is firmly engaged. Warning: never hold the inflow valve by the top of the textured titanium when attempting to engage its threads. This could cause twisting and disruption of the porcine valve within the conduit, resulting in subsequent inflow valve regurgitation once the device is actuated. Next, apply the outflow valve conduit to the outflow side of the pump, the left side when the anterior side is facing you. Turn the screw ring at the base of the outflow valve conduit clockwise until you hear a clicking sound, then continue turning it until the connection is tight. Caution: all connections should be hand-tightened only. Do not use tools or other instruments to tighten any of the connections on the HeartMate device. Then, prime the pump with sterile normal injectable saline solution by filling it through the inflow valve conduit with an asepto syringe. Continue priming until the pump appears full, rotating and gently tapping the blood side of the pump to dislodge any air bubbles. To prevent loss of priming fluid and contamination of conduit valve threads, apply a finger cot cut from a sterile, non-powdered glove tip to the top of the textured titanium of the inflow valve conduit. Finally, attach the solid white thread protector to the top of the outflow valve conduit. Once primed, the LVAD pump may be left soaking in a covered basin containing an antibiotic bath until the surgical team is ready to implant it. Caution: keep both the tunneling shroud and the end of the tunneling bullet dry. After completing the pump assembly, remove the system controller and controller battery module from their sterile packaging. Place the sterile controller battery module in a safe location on the sterile field for use later. Pass the two sterile system controller power leads out of the sterile field and connect them to the bifurcated ends of the PBU cable. Note, both the PBU and system controller will indicate a hazard alarm condition. Reset these alarms by pressing the alarm reset button on the system controller panel. Examine the system monitor to ensure that the controller is in fixed rate mode and set to operate at 50 beats per minute. If necessary, the non-sterile team member can change the mode or adjust the controller's fixed rate using the system monitor's touchscreen. Once the controller is set up and working properly, disconnect both its connectors from the PBU cable and use caution to prevent the ends of the controller leads from touching the sterile field since they are now contaminated. This completes the HeartMate LVAD device assembly and setup. For more information about these procedures, please refer to the printed instructions for use, which come packaged with each unit, or the HeartMate operating manual available from Thoratec Corporation.